I do need to confirm that we did do some more data reconciliation yesterday around our case numbers. In fact, yesterday's number was reported as 2189, was actually 2159. So I apologise for a slight imbalance in our data reporting. There'll be full details in the show release this afternoon, but the actual number for yesterday was 2159. In terms of overall case trends and case patterns, they're very similar to where they've been over recent days and weeks. I won't go into all those details. We continue to see high active case growth, particularly within the southeast of Melbourne. But what I can say, if I look over the case numbers over the last 7 days, we are continuing to see a fairly stable trend over that period of time. Our rolling average is around 1,925 over the last 7 days. That's entirely consistent with the Burnett modelling at this point in time. And of course, our behaviours over the coming days and weeks will determine where those case numbers go. We're obviously very keen to keep them under constraint and to get them down a bit as we continue to go forward on our vaccination programme. Hospitalizations have also stabilised over the last 7 days. It's been a very welcome trend to see actually a lower number today, 770, compared to the numbers we've seen over the last few days. And my thanks, huge thanks to everybody working, particularly on the front line in our hospitals dealing with COVID patients, but our wider healthcare workforce for the phenomenal work they're doing to support those with COVID and those with other conditions who need their care and attention at this time. One angle we are picking up is we are seeing a growth in regional cases, and we're seeing a growth in younger people catching COVID. We're seeing of all the cases today, over 14% are in regional Victoria. That's a significant increase on where we've been over recent days. What we're also seeing is far younger people catching COVID, so a greater proportion of younger people in our case numbers. If I look at Metro, 29% of all cases yesterday are under the age of 19. So these are our children and our students who are clearly very active in the community. In regional Victoria, 38% of all the cases are under the age of 19. And we continue to see that profile in the other age groups. For Metro, 2/3 of all positive cases are now under the age of 40, and for regional, 3/4 of all cases are under the age of 40. So please, I'd call out to the younger Victorians amongst us. You are particularly vulnerable at this point in time in running into friends and associates who are COVID positive. Please take every care to make sure you don't become one of those statistics. Key regional locations of interest in Latrobe City, we've had 40 more cases today, or in today's numbers. We have a total active cases just under 300, 283, with a number of different settings, including a number of household settings, but also education settings and some school settings coming forward. We've also seen a significant number of cases in Wodonga with 21 new daily cases, 62 active cases in Wodonga, but very closely related, of course, to our colleagues in Albury. And I'd like to thank our colleagues in New South Wales Health and all the local parties in Wodonga and Albury for their close cooperation. We're managing this as an interrelated set of outbreaks and clusters. As a very good cross-border work going on to support the community up there.